Parents of children with autism spectrum disorder naturally want to know what might happen when their child grows up. Because autism is described as a spectrum disorder, there's a wide range of severity. Some children have mild symptoms, some children have severe symptoms, and a lot of children have symptoms that are in between. And the outcome in adulthood really depends on where along that continuum the child might fall. Almost all children with autism spectrum disorder do show improvement over time. And so with the effects of interventions, such as behavioral therapies and speech and language therapies, children do make gains across all areas of function. Some children with autism spectrum disorder grow up and have mild symptoms, are able to go to college, have a job, get married. But some children with autism spectrum disorder, as they get older, continue to have significant difficulties and will require extra supports and have difficulty living independently. There's some evidence that adults with autism spectrum disorder have difficulty getting and holding jobs. And one recent study showed that only about half of adults with autism spectrum disorder had been paid for employment in the past 8 years. However, things are changing, and some companies are actually specifically hiring individuals with autism spectrum disorder to take advantage of some of the special skills that they have. There is evidence that outcomes for individuals with autism are improving over time. And so this probably represents better identification and better early intervention for children. Interventions in early childhood should focus on improving communication and social skills. And we have good evidence that intensive behavioral therapies can help improve outcomes later in life. The better a child's communication and cognitive skills are, the more likely they are to be able to function independently as an adult. So early identification of autism and early treatment is key.